Hi everyone, Danelle here. It is October National Physical Therapy Month, and today we're going to be talking about low back pain. So this is a really big topic, guys, and there's so much I'd love to share with you, but due to the timing of this video, I can't share everything. So two things I'd like you to do. Log on to 3ptdc.com, go to the blog section, and there you're going to find a bunch of articles and some blog posts that I have posted that will give you some additional information and tips on that should be really helpful to help you make the best decision about your back. And also, as I talk, there is a specific condition that you'd like to know more about, please post in the comment section below and I will make a separate video about that for you. So to dive straight into this, back pain, when we're talking about back pain, we're really talking about the lumbar spine. It starts at L1, it goes down to L5, but can also involve the lower thoracic and sometimes even the sacral elements and pelvis. The causes of low back pain vary and really have to do depending on the structure that's involved, which can be the bone, the ligament, the tendon, the muscle, the disc, or any interaction between any of those. So you have probably heard different diagnoses such as stenosis or sciatica or spondylolysis or spondylolisthesis or herniated disc. And that has to do with the specific issue or problem that's causing low back pain. So low back pain is really an umbrella term under which all of these other diagnoses fall under. Common signs and symptoms of low back pain are dull, achy, stiffness in the lower back, problems with motion, sitting for a long time, standing for a long time, walking for a long time, and also pain with anything that loads the spine. So if you're doing any heavy lifting, kids involved and included in this, grocery lifting, if you have a job that requires lifting, or anything that mechanically loads the spine in terms of running, jumping, squatting, and any sort of dynamic activity can also cause low back pain. In its acute phases, it can be really bad where you're unable to do simple things required in your daily activities, such as getting in and out of bed, getting in and out of a car, or just being able to sit through a meeting. And it can really be debilitating when it gets really bad. So those are the common signs and symptoms that you would see with low back pain. Now, how do we treat it? And this is where the information is so big out there, and there's so many things that I want to share with you. Right now, if you've been paying attention to what's been going on in the news, you would be aware that we are in an opioid epidemic in the US. And that is because the usual medical intervention for low back pain has consisted of medications, injections, and surgery. And what has happened, because this really kind of aims at alleviating the symptoms and not the cause of back pain, you find people getting to a situation where they get used to these pain medications, they have to get up in their dosage, or they have to go to a stronger pain medication to manage the same symptoms that they had. And this is where the epidemic and the addiction starts getting in, and we start getting into this crisis. So from a physical therapy standpoint, the research has shown quite a long time ago that the best interventions and the most successful interventions for low back pain is a combination of manual therapy interventions, things that we do with our hands in terms of manipulating the muscles and the bones and the tendons, along with targeted specific exercises for the low back. And that has shown the most improvement in terms of function, pain, return to activity, and also longevity over time. So that is an alternative that you can use in your decision-making process about what's best for your back pain and how you would like to treat it. The people that are going to be best able to help you diagnosing your low back pain, not only in terms of saying we have back pain, because just about anybody can point to their lower back and say, hey, I have back pain, but finding out your specific diagnosis is going to be an orthopedic physician or an orthopedic physical therapist. Chances are the orthopedic surgeon is going to send you to a physical therapist anyway, so my 2 cents, come directly to us so we can get you started on the things that can really start helping you to take care of this back pain that you're having. There are lots of great things and tools that we can do to resolve not only your pain, but also get you away from just throwing medication at it and really looking for a long-term lasting solution to your pain. So that is back pain in about 5 minutes. Okay. And again, as I said, feel free to check out 3ptdc.com, and there you'll get a little bit more information about tools that you can use to help make your decisions about your low back pain, and put comments below so that I know if there's something specific you'd like to talk about, and we can talk about that some more. All right. Have a good day, guys. Have a good physical therapy month.